All right, good morning. Here we're at it with another practice question focused on the lungs, helpful for Step 2 CK, IM Shelf, or COMAT, and let's jump into it. As always, go ahead and pause, answer the question for yourself. It's only helpful if you're actively testing yourself, and then we'll go ahead and get started. All right, here we have a 9-month-old, previously healthy boy brought to the pediatric office. He's had increased work of breathing, nasal congestion, parents note a low-grade fever, non-productive cough, and some wheezing, and it's asking us what's the most appropriate next step. So I hope when you see a 9-month-old and wheezing and lung problems, you're thinking of the most common cause, which is RSV. And something important whenever you're dealing with something viral like RSV is you want to rule out other bacterial causes. And so because of that, one of the first things you want to do is obtain a chest x-ray. So with a 9-month-old and expiratory wheezes, I hope you're thinking of RSV. This infant's presentation with a lower respiratory tract infection, as evidenced by his increased work of breathing, cough, wheezing, and a low-grade fever. A chest x-ray is indicated in case of lower respiratory tract infections to assess for findings such as pneumonia. Although RSV is a common cause of bronchiolitis and lower respiratory tract infections in infants, a chest x-ray helps rule out other potential causes of respiratory distress, such as bacterial pneumonia. In the absence of other concerning findings, such as severe respiratory distress or signs of disease, outpatient management with supportive care is often appropriate for mild to moderate cases of RSV bronchiolitis. A. Beginning empiric antibiotics is not the initial step in management of uncomplicated bronchiolitis caused by RSV. B. Administration of albuterol is typically not effective in infants with bronchiolitis unless there is a strong clinical suspicion of concurrent asthma, which is not described in this case. Prescribing oseltamivir is not indicated in this management of RSV. Oseltamivir is used in the treatment of influenza, which we're not seeing here, especially with the age. Influenza would probably present in someone a little bit older, and admitting the patient for oxygen supplementation may be necessary if the child had severe respiratory distress and hypoxia. However, the initial step is to obtain x-ray to assess for potential causes of respiratory distress. And here I included an image, what we call a steeple sign. This is what you would see on x-ray, and that would help confirm RSV because it often presents with a little steeple that is very commonly seen in RSV. So there you have it. Please like and subscribe. Comment down below the kind of questions you'd like to see in the future, and I'll see you in the next one.